Hello, everyone. Anne-Marie Chiz here, your president and CEO of Rome Health, and welcome back to AMC Connects. We have a great episode for you. We're going to have a deep dive on a meaningful conversation that's critically important to Rome Health, which is patient experience. Also, before we jump into that conversation with a special guest, we're going to go over a brief update that was on a previous episode from CMS, as well as a couple best practices. So stay with me. Thank you, everyone, for tuning back into AMC Connects. And if it's your first one, well, welcome. We do have a lineup in 2026 that we think is very informative and fun. Chuck and I do work to be fun on this episode, as well as give some really good information regarding Rome Health and maybe even community dynamics. I believe it was our AMC Connects pilot podcast, episode 1.
There she goes again, knowing all the numbers. How do you do that?
Well, I'm excited that it's actually not just me. We have a special guest today, which we'll get to very, very quickly, who actually had said they've seen every single one. So make sure you stay tuned for the whole episode so you can meet our special guest. But back to AMC Connects pilot podcast number 1. We did go over a bill that was passed at the federal level, the OBBBA, or now HR 1, which was highlighting some impacts that were going to deal with healthcare. Not the whole bill, but certainly there was going to be some big effects that may impact healthcare overall in the nation, and then certainly New York. In the community, as well as stakeholders within Rome Health, asked for more information. So it was a great topic to be able to kick off our pilot phase of the podcast. But we're far beyond that now. But we did recently receive an update from the Hospital Association of New York, which did announce, fast forward a bit from the impacts, is that there was going to be a pretty significant grant launched at the federal level that states could apply for. So here's just a brief update from, as I said, the Hospital Association of New York on behalf of CMS. New York gets $212 million of rural health transformation funds. CMS announced today that New York will receive over $212 million in 2026, the first of 5 years of a federal rural health transformation grant. All 50 states were approved for awards for 2026, ranging from $147 million for New Jersey to $281.3 million for Texas. New York submitted its application for funding under the program on November 5th, highlighting plans to direct the funding toward 4 key initiatives: establishing coordinated rural health partnerships, strengthening rural communities with technology and enhanced primary care, building a sustainable rural healthcare workforce, and investing in technology innovation and cybersecurity enhancements. The Department of Health has said, if approved for the federal rural health transformation funds, it would release a series of applications for funding in 2026. Haney's will continue to engage with the Department of Health and share information about distribution of the funds. The Rural Health Transformation Program's $50 billion approved, as I said, part of HR 1, will be allocated and approved states over a 5-year period, with $10 billion available each year for 2026 through 2030. Half of the funding is distributed equally among all approved states, with the remaining 50% allocated based on factors related to the rurality of the state's state policy actions. CMS views as enhancing access and quality of care in rural communities and additional factors. New York has requested $200 million per year in its application per CMS guidance, as did most states according to the compact application abstracts filed by CMS. So with that, looking forward to be able to working with the Department of Health on, in fact, we can apply. We know here at Rome Health, we've been on a great journey to transform community-based healthcare, and so it's certainly biased, but I think we'll be a great applicant in the application period for New York. But more to come. as we continue down that path and work to be able to receive funds award to continue our journey. We've been very blessed by the state and other grant applications that we've submitted. We've been able to receive many of them over the last 5 years. So here we go. In 2026, we'll keep it going. As I said, one of the main topics this morning is to be able to go over our patient experience. I am grateful to be able to be on a journey to enhance patient experience here at Rome Health and throughout our network, and very excited at the components that we have here. We're not perfect yet, but we are working hard to be on a pathway to perfection in terms of every patient that we take care of across the network, and their caregivers would have a phenomenal experience as they interact with Rome Health. Over the years, I've certainly done a lot of reading and understanding of what best practices there are in terms of patient experience. And as we lead off into our special guest, who really leads us through our patient experience programming here at Rome Health, very excited to be able to have a deeper conversation with her. Just to go over a few outlines, hospital best practices for patient experiencing, focusing on compassionate communication involving patients in care, creating a healing environment, and streamlining processes to reduce stressors for patients. Key strategies include empathetic staff training, clear explanation of care plans, involving family in rounds, providing comfort, cleanliness, amenities, less noise, managing pain, improving discharge instructions, and using technology for communication and feedback. You know, again, I have an inside perspective, but I think Rome Health has done an amazing job focusing on a number of those areas. But here to talk more with me is Allyson Daniello. Allyson,
hello.
Welcome to the podcast. I'm very excited. One of the first things Allyson shared with me is that when I said, well, have you seen the podcast? We'll go over that. She said she's seen every single one.
Every single one.
Allyson, thank you.
Yeah.
And certainly very proud that Allyson's with us, who is a daughter of Rome. And I mean that with the utmost respect and confidence. We were having a little bit of a discussion about that. But we have so much competency, leadership, and expertise that has come from Rome. But she hasn't always been in Rome. She's been away and she's returned home and thankfully came to Rome Health to help lead us through this unbelievable initiative. Allyson, can you tell us a little bit more about you, what you do for Rome? And maybe where you've been and why you're back.
So I am the patient experience coordinator for all of Rome Health. I act essentially as a liaison between the patients, their families, our staff, just to ensure that everyone has a good experience. We want to, like you said, promote empathy with our patients and sometimes giving that little bit of additional guidance to our staff. Mm-hmm. You know, staff can forget sometimes that they're at work and while they're at work, you still need to focus on empathy and treating patients like they're your family. Yeah. So it's just kind of being there for that additional support.
I like that. I like that you said a liaison for our patients, maybe their families or caregivers, and our employees and our workforce. Mm-hmm. And I really appreciate that you underscore empathy. Mm-hmm. I love that so many of us in the workforce are very comfortable at work, but sometimes, like you said, we can forget maybe where we are in our comfort, and we want to make sure that we put the patient at the center of what we do. Now, I said this at the beginning, but you were raised in Rome, and then you left and got great experiences, life experience, and now you've returned. Where were you?
I had moved to Baltimore, Maryland. I was there for close to 15 years. Wow. Originally, I was in ophthalmology, and it was a weird occurrence, honestly. I happened to get into optometry really before I left Rome, accidentally. My neighbor offered me a job. I ended up working for Empire Vision, and the doctor that I worked with there just goes, "You need to go into ophthalmology. You're a little too smart."
What?
And I went,
what a compliment.
Huh, okay. So ended up moving down to Baltimore, found an office there that was willing to give me the training to become an ophthalmic technician. And from there, I was with a private practice. Then I went to Johns Hopkins. Then I went to Sinai, which was a LifeBridge Health Corporation. And I was with LifeBridge for 12 years. Wow. In my time there, I was a supervisor. And it kind of led me into the whole patient experience aspect,
Sure.
where most of my coworkers, they did not want to deal with any patients that were upset or concerned or anything. I could handle that pretty well. I was pretty empathetic, which was good for me.
Yeah.
That we had someone there to handle that. Most people don't like eye doctors. It's like eye doctors, dentists, they don't want you touching their eyes.
Sure.
So it really helped to kind of give me all the patient experience kind of experience.
Yeah, that you needed.
Yeah. So that's when I decided around COVID that I was going to be moving home. Things just changed very dramatically. And I went, I need to be closer to my parents. My niece and nephew, they were down there as well, and they were getting older and didn't quite need me as much. So felt like, well, I could come back home and be with my parents and spend the time with them, and ended up at Rome Health and fit pretty well into the patient experience coordinator position.
I would say so. I've worked with patient experience officers or coordinators for some time, and I'm just very fond of your approach, Allyson. I think
thank
you do
you.
a great job. I think when we first talked, making sure that the difference between kind of the overall patient experience and maybe the complaint process, we're required to have a complaint process by New York State. Do you want to walk us through that a little bit and maybe what you do?
Sure.
Yeah.
So as far as the complaint process goes, it's very basic. We try to involve all of our staff. If someone comes to you with a complaint or a concern, we want our staff to take every assurance that they can possibly handle that themselves.
Excellent.
When they can't, then it gets escalated up. Most of the time, we will document any concerns in our safety zone portal. The safety zone portal will come to me automatically, and I will address any issues that come to me regardless if they've been satisfied or not. I always want to do a follow-up call with the patients or families that have had the concerns, making sure that we're just kind of closing the loop on the communication with them. That's the most important thing, is that patients and families feel communicated with. When they don't, they will let you know. And it is overall a process that it can go to a grievance level, but I try to keep it from that. And I've been thankfully pretty successful in reducing the amount of grievances just by making sure that we're communicating with patients when a complaint or a concern does come to us. Overall, it's just a documentation process as far as the complaint or concern goes, making sure that we can always go back and see if we haven't resolved it. What steps do we need to take further to resolve the issue or concern? Do we need to make improvements or changes within the organization, or is this something kind of minor that we can just address?
Yeah. I feel like you follow the ACT process really well, that you acknowledge and you encourage all of us, if we're directly involved in a concern, trying to avoid a complaint, correct it, and certainly thank patients and or family members for bringing it forward. I've seen you do that routinely and follow that, which I think has been really helpful in building the trust in the community that we've been striving for so long. Excellent. And now patient experience or patient satisfaction, I mean, that's a substantial part of our overall rating as a healthcare network, right?
Yeah.
And we've been working very hard on that program as well. So the avoidance of grievances is kind of one aspect, but our overall generalized patient perception and experience you work on with us too. Tell us how that's going.
We are making strides, I will say that. We are working with a multidisciplinary group, working on KPIs, key performance indicators, trying to figure out ways and strategies that we can kind of come together to improve our patient satisfaction scores. Our patient satisfaction scores, obviously, they come from Press Ganey. If anyone doesn't know what Press Ganey is, it is a national benchmarking kind of association that they send out surveys to pretty much everyone in healthcare. If you don't use Press Ganey, I'd be shocked. But these scores and surveys, the surveys are sent out to the patients and their families. They're sent back into us, whether it's electronically, by snail mail, whatever the case may be. These results come back, we report out, we are able to nationally kind of compare ourselves to like offices. it gives a lot of really pertinent information
Yes.
that we can utilize to figure out, okay, we need to work on this area a little bit more than this. We have a focus on cleanliness, on communication, quietness, which, quietness when you're doing construction can get real tricky.
Some of our projects have made it challenging for this work too, but
Yeah.
you've helped us offset some of those concerns, Allison.
Thank you.
Yes, very well.
So, overall, we do have a lot of folks that are involved in the patient experience process.
Yeah.
It's just getting that, like I said, the engagement to go into it where everyone is so busy. We have constant flow of patients coming in, which is great.
Yes.
But it does create that I've got to get things done. I got to keep moving,
Yes.
got to keep moving.
Stress.
But you've got to also put the focus on the patients. Treat them like they're your family members. And that's what I really just try to emphasize to everyone.
Excellent. Can you share with us the areas that are demonstrating we have a great strength in here at Rome Health?
Overall, we tend to work pretty well as a team. We are good at going to each other saying, hey, this is where some work needs to be put in. Let's try to fix it. Let's see what we can do to engage everyone. Putting out additional education. We have a great education department. They're always willing to help. So I think overall, we are lucky that we do have such active members of our team.
Excellent.
If we didn't have that, we'd be in trouble.
Sure. And where do you think the area is that we should focus more as we head into 2026? Where is the greatest opportunity for improvement for us?
Just in general, it is the communication.
Ah.
It's not that we're lacking necessarily, but you're finding now that patients and families want more and more and more information,
Yes.
which is understandable.
Sure.
I want to know all the details.
Absolutely.
When I've been a patient myself, or if my parents have been a patient, I want to know everything.
Yes.
And you need people that are willing to put it in layman's terms and just make it digestible. So the more information we give, the better.
Excellent.
Otherwise, we're getting people calling and, saying, I didn't get this or I don't understand that. We need to communicate as much as we possibly can, which is hard when there's a high census.
Yes.
And, one doctor might have 22 patients.
Yes.
That's a lot
Yes.
to handle. So taking that time and breaking it down so that everyone gets ample amount of time, that can be difficult. But it's more making sure that at the end of the conversation with a patient, you think you're done, confirm with the patients and the families that they're done.
Yes.
Do you have any questions? Do you have any concerns? It's that closing of the loop.
Excellent.
Do you feel that the patients, like the family members, that they're better educated nowadays, and so they know to ask more questions than just kind of like the doctor comes in, says, hey, here's what's going on, and we just, I'm not going to lie, sometimes I'm just like that, I just, okay.
Yeah.
And I don't ask the question, like, are they better educated, and where do you feel the education might be coming from? Is it just TV or reading or?
Well, TV probably helps. I'm not going to lie. I've learned a lot from Grey's Anatomy. But, yeah, I do think that, we were given a lot of information when COVID hit.
Yes.
So much so that, you were almost overwhelmed with how much information you were getting. Not that it was a bad thing, but I think that people are asking more questions now.
Right.
It's not a bad thing.
Yeah.
The more, the commercial, the more you know.
Yes.
That's the way I feel.
Don't date us.
It's not a bad thing.
Well, that's a good segue, Allison, too. What would you share with the community? Because hopefully there'll be some community members who are tuning in to the podcast and its availability. What would you share with them about how to engage with Rome Health? Either if they have a concern or if they have an accolade or if they need something.
Yeah, I really try to make myself as available as possible, whether it's by email, by phone. I'm happy to talk to people in person. Get in contact with me.
Excellent.
Because I'm always willing to have the conversations. I'm always willing to take feedback. Just any ideas that someone might have. We received a lot of feedback when it came to our parking
Yes.
and how things should be done there. When we opened up the medical center, what services we need, and we ended up getting a podiatrist out of that.
Yes.
That was a major thing.
It was.
It was huge. I mean, the amount of requests that would come in via the website, everyone wanted a podiatrist.
Yes.
And what do we have? We have a podiatrist.
And a great one.
He's fantastic.
Yes.
He's so nice.
Allyson, I'm so glad you brought that up because two things. One, we want to know. We want to know from our community what's needed, what you're thinking. And Allyson is an excellent key contact. Again, a little bit biased, of course, but there's a lot of evidence and there's a lot of people who agree with me on that. But also the feedback from the community in real time really matters to us, like the podiatry conversation. So thank you for using that as an example.
Yeah.
I think it's tremendous
Yeah.
to make sure that we're hearing as timely as possible. And I was going to highlight this towards the end, but Allyson was really the leader and facilitator with our most recent opening in 2025 because in all seriousness, parking is, we want to be very convenient here at Rome Health, whether it's the main campus or a number of our other network sites. And we heard a lot about the lack of convenience when we opened up in 2023, the medical center, and really had kind of a hill to climb. And Allyson, with all the feedback from the community, helped us make sure that we could navigate a better experience. And how do you think that went, Allyson?
I mean, all I can say is I'm so thrilled that we created more parking in that front parking lot.
Yes, go building services again.
It
Yes.
was outstanding.
Yeah.
I mean, I was lucky enough, obviously, to see the progression of everything. But when we opened up that medical center, it seemed to really cause a struggle with the parking. Everyone was so used to parking there before to go to medical imaging. And now that we've created this better flow,
Yes.
it has made the parking significantly better. And I have to tell you, I haven't gotten a phone call about parking in months.
You just jinxed yourself.
I know.
Keep on Allyson for a second. Chuck, go back to Allyson
I
because
know.
we want to pull out
Uh-oh.
26 for that. Allyson, thank you.
Yes.
Thank you for that.
Yes.
Right? I mean, that was, because it was almost daily, in fairness to the community and to all of us.
Yeah.
And you just helped us champion a creative approach along with all of our stakeholders. So that was a huge win.
It was.
Well, Allyson, I think in summary, as we're listening to you, some things to keep in mind as we head into 2026, because we do want to be the very best care out there here. And that includes probably some of the top of the list, our quality and patient experience. So communication, you shared a couple minutes ago that communication is of utmost importance. And we really need to make sure we're focusing on a connected communication, right? And so some of the leading practices in the literature is to convey a sense of communication and connectedness, listen and explain, particularly in specific terms that are connected to that patient need. Introduce ourselves. We think sometimes that we have to do some very innovative things, but it's sometimes in the basics that we matter the most and connect with. Involve patients and families in the overall experience and care plan, right, of the patient. Great. You had talked about the environment and cleanliness. The environment is directly connected to comfort, so cleanliness and the overall ambience. I know we had in a pilot podcast Barry on, who's working so hard
Barry's
with that
the best.
team. But yes, it's all of us, right,
Yeah.
that really need to lean into that. And then certainly maybe having some amenities. You and I've talked a little bit about amenities in the environment that we can add. We're working on that. Process and efficiency. I think in part we've really worked hard to make sure time is of utmost importance, right? And we want to make sure that we have timeliness and responsiveness for our patients. Minimizing waits. We do here in the emergency department that the wait time is one of the most significant factors that we can help make sure that patients have a good experience. Streamlining discharge. I was looking at some of our patient experience scores, and we do very well in the discharge planning process. Kudos to our care coordinators and our case managers. And you said this, and I'm so thankful you did again. But as we orient ourselves to becoming the workforce of Rome Health, we really want to make sure there's empathy training, and we have an authentic approach to how we connect. That's Rome. That's Rome's culture. So if we're fake and we're not necessarily our authentic selves, people are going to see through that, right?
Yeah.
Some other best practice, empowerment, making sure that all of our employees are empowered to connect with our patients and from their families and caregivers in real time and do what needs to be done to advocate for them. Allyson put herself out there. If we need more resources or help, she's just been an incredible conduit to make sure that we have what we need to have a strong patient experience. So Allyson, thank you for being with us and sharing a little bit more about patient experience and your role. Very excited to connect with you a little deeper on our rapid fire questions.
Okay.
Great. So number one, what's your go-to gas station snack?
I honestly will almost never go into a gas station.
Okay, tell us more about why
I am
that
a
is.
pay at the pump kind of girl. I live 2 minutes away, so I almost never get gas.
Speaking of efficiency, you are an efficient human being. That's what that means. So
I am an Apple Pay kind of girl. I use my
Look
watch
at
for
you.
everything.
okay.
So you will almost never find me inside a gas station. But I do have to tell you that I am a big, like, Hostess cupcake fan.
Wow.
And I always have been since I was a kid. So if I was going to go in and just be bad enough to get something,
it would be
it would be a Hostess
snack.
cupcake.
Okay, but which one? Because
Ooh,
I'm not gonna lie, I enjoy them every once in a while too. But which one is the go-to?
The chocolate on chocolate with the little white swirl.
No,
Always.
no, the yellow one that tastes like orange, but they call it something else.
No. That is honestly the worst
No,
one.
it's not. Quite okay. You're muted.
That's terrible.
Allyson, I love that you're the chocolate on chocolate with
Yeah.
the white swirl, whatever the white stuff is. It's my favorite too. Okay.
Yep.
Have you ever won a contest?
Contest? Not necessarily. I did win a grill from
That is-
Old Navy of all places.
Oh my gosh, that is big. How did that happen?
I answered a survey. Which is funny because I swear I don't think I ever fill out surveys anymore now that I'm looking at surveys all day long, which is funny.
Yeah.
But I won a Weber charcoal copper grill.
Wow.
And I'll tell you what, I used the thing one time and sold it. I don't like charcoal grills, apparently. It's way
Okay.
too much time and effort.
Got it.
I like a gas grill now.
Okay. And well, what we're starting to know about you is you're an incredibly efficient person.
Yes, yeah.
Yes, the apple,
Always
the digital
have been.
This is excellent. Look at how much we're knowing Allyson, Chuck. This is great.
Love it.
Favorite toy as an adult?
Oh, as an adult?
I know.
Oh,
And it can't be the cat.
the cat's so cute.
Okay.
A toy? That is like the hardest thing.
It's a hard one.
Do I have to own it or could I have just used it before?
You could have just used it.
Okay, well then I have to say the VR machine. And
Like
playing-
Oculus or
Uh-huh,
okay.
Oculus. I played Fruit Ninja on the
Oh.
Oculus. I thought it was the greatest thing ever, and I'll tell you what, it was probably the best workout I've ever had.
Wow.
It was insane. I looked like a crazy person. There's video somewhere.
Can we get that video? Yes.
Video,
We
Chuck.
need that video absolutely. So get that to me.
There is video somewhere. I know it, and that was honestly the coolest toy. I debated on buying one for myself, but was afraid that I don't have enough space in my living room and I'll
You know
run into
what?
something.
There's no year like 2026 to
Yeah.
treat yourself to a little bit more fun.
A little VR action.
Okay, your favorite movie
Of all time,
of all time?
Adventures in Babysitting.
Oh, that is a great one.
Okay, I'm out on that one. I don't know that
Wow.
Elizabeth Shue.
Yes.
It was fantastic. You need to watch it.
Yes. That is classic.
Yeah.
Listen, that is,
Love it.
Oh, that's a good one. Okay, last one. Your hidden talent.
Oh God, I don't think I really have
one. Oh, you got
Oh,
one.
you have one.
a hidden talent.
You can't be as excellent as at your role for the organization if you don't have multiple hidden talents. So give us just one.
Oh, this is like mind-boggling because I don't really think I have a hidden talent.
It can be just a talent we don't know about. That'd be hidden to us.
Yeah.
It may be something that like everybody knows, but we don't.
I don't. This is difficult because I don't really think I have any sort of hidden talent for anything.
You're good at the party planning.
I'm an extreme organizer.
Okay.
That's good. That's
Yeah.
good. That's good. We wouldn't necessarily know
My
that about
my
you.
parents think I'm a little OCD and crazy probably.
Sure.
But I organize everything. My closets are color coordinated. They are in order of style.
Listen.
Yeah, it's a little bit much, but
No wonder you always look and seem so put together. Though.
oh, well, thank you.
Yes, you do.
I
and you know,
appreciate that.
the talk about secrets. The secret reason we ask that final question is because as I get to know people a little bit deeper, like we've done to you already, those other duties as assigned can come. So now that I know the level and depth of your organization, like
Yeah.
maybe
It's a bit extreme, not gonna lie. It might not be as much at work,
you're making me laugh.
but at home, it's extreme.
Well, Allyson, thank you. Thank you for being on the podcast and sharing
you.
a bit about yourself with us, and so appreciate all you do for our organization.
Thank you.
I have been in awe of how much ground we've gained on a formal level when we come to patient experience. You're doing an amazing job.
Thank you.
Thank you very much for all
Appreciate
that you
it.
do. In closing, I'm going to, thought it was great. I had received a Press Ganey survey that usually actually goes to Allyson, but for some reason it came to me. Maybe it was meant to be. We had a patient give great feedback recently on the medical practice survey, rated us all 5s in every category. So I thought I'd just give a few summary points because it does highlight some of our excellence. And again, Allyson coordinating with all of us, so many, it's just one of her, and she has so many of us and patients, but the patient shared comments in nearly every section, scoring, again, a 5 in every area for us. But kind of a comment on the registration side for a patient. My experience was very good. Staff directed me to the areas where I should go to as soon as I came into the area. I did not have to guess about where to go when I arrived. I mean, that speaks to time. That speaks to effective communication that Allyson was going over with us. In terms of access, the patient shared with us, it was easy to speak with someone when I needed to figure out where to go. I mean, this says that people really don't want to come to care and be confused about where to be. Moving through the visit, the patient shared with us, staff at the registration area were very nice and helpful as they directed me where to go, including the clinic area. The nurse and assistants listened to me intently and were concerned about matters I asked them about. In terms of the care provider, the patient shared with us, the care provider was concerned and took time and explained her line of questioning with me. The physician was thorough while explaining possible side effects to everything that was going on. The physician was thorough while explaining procedures and next steps to me. On the personal issues side, again, still scoring a 5 in all of these areas, the patient shared with us concern for privacy was exceptional. My racial background was respected, and I felt staff cared about my feelings in different ways that were unique to me. On the billing side, again, the patient scored a 5, that this topic was a discussion for me and everybody did it with a respectful manner. Overall, the patient shared with us that the facilities were very good, clean. Again, staff directed me where I needed to go. And her comment was, my experience with the healthcare facility has been very, very good. This hospital is my first choice for me to get any care I need. And on the overall assessment, the patient shared with us, staff were excellent and they were worried about my health and well-being. I do recommend to patients to go to Rome Health and also tell my family members this hospital facility is the first choice. So we so thank the community for giving us all kinds of feedback. We do appreciate the positive feedback and we appreciate the areas of opportunities that we might need to have. So thank you for sharing feedback and thank you to our workforce for continuing to create the best care out there here.